Hello everyone, I'm Dr. Rohan Khandelwal. I'm a breast cancer surgeon and I practice at Birla Hospital, Gurgaon. So after any breast cancer surgery, the patient will usually get a drain, whether it is full breast removal or mastectomy or a breast conservation surgery, the patient will get a drain like this. Right, now this drain, we usually discharge the patient with the drain. So they need to know how to manage the drain at home, which is what I'm going to discuss a few tips which would be useful for you as patients to manage this drain set at home. So this drain set is attached inside and it is secured so that it does not come out. So one precaution which we tell all our patients is that please make sure that nobody pulls on the drain. And I have had patients who've been dog moms, and as soon as they've gone home, the dogs start jumping on them and they pull out the drain. So, or if you have little children at home, they can also tug on the drain and it can come out. So you need to be careful about that the drain does not come out. And usually if the drain comes out, you would see soakage at the side where the dressing is present. Now this is a negative pressure drain and this is the lock. So one thing which I want to be very clear about is that once you've emptied the drain, you always open the lock. Because if you don't open the lock, what is going to happen is that all the fluid will keep on accumulating and that will create issues. So this is the lock system and this is when you unlock it. So it should always be unlocked. Only lock it when you're cleaning the drain. So the cleaning process, the first step is that you have to lock it, right? So I've locked it. Then you need two people for this, right? One person will open this up, you just unlock it and you empty out the drain. So you can see we've emptied out the drain contents, you empty it out. Now you need the second person, right? So once you've cleaned up the drain, one person is going to press it, right? So you can see that this is being pressed. This is being pressed and now I'm going to tighten this or close the cap properly, okay? Once I've done this, then I have to unlock the drain. And if I've done everything correctly, this would remain compressed, okay? If supposing we did not put the cap properly, this would raise up, or if there is a leak somewhere, then this would raise up, or if the drain has come out, then it would raise, right? So these are the three situations when the pressure won't be maintained. A, if you have a leak, B, if the cap is not proper, or C, if the drain has come out, okay? Now, one more problem which patients sometimes call us with is that they say that the drainage is not continuous. So it's not continuous. It will sometimes come, sometimes it will stop. It will not keep on draining the entire day. So that one should be careful about. Now usually what we follow is that the output should be less than 40 cc for 2 consecutive days, and that's when we pull it out. Now every unit can have their own guidelines. This is what we follow and this is what we tell our patients, that in a 24-hour interval you note the drain output and then you send us a picture of that, and accordingly we take a call when to remove it. Now sometimes there can be a clot in the drain as well, right? Here you can see there is no clot, but sometimes there can be a clot and this clot cannot be cleaned by the patient, right? For this you need to come to the hospital and we would need to clean the clot for you. So these are some care tips which you need to know regarding drain care, and if you're aware of these, they will help you to manage the drain properly at home. Also what we recommend is that you can just take a sling bag, you can put the drain bag and hang it over your shoulder and you can move around, and that will not hamper your daily activities. If you have any other questions regarding drain care, please do put them in the comment section and we'll be happy to answer them. Thank you.